It's the middle of the night. Something deep in your mouth is throbbing a rotten, pulsing ache that beats in time with your heart. You can't sleep. You can't think. You can't make it stop. And there's no cabinet to open, no pill to swallow, no pharmacy glowing on the corner. There's just you, the dark, and the pain. For almost the entire span of human existence, this was the deal. Today you live maybe 10 feet from something that can erase pain in 20 minutes. A headache, a cramp, a broken bone. We treat them like minor interruptions. But for roughly 300,000 years, there was no aspirin, no morphine, no anesthesia. A toothache could last for months. A broken leg meant agony with every movement. And childbirth, infection, a rotting tooth, a wound that wouldn't close, these weren't inconveniences. They were the texture of being alive. So how did they stand it? How did human beings survive in bodies that hurt for thousands of generations with nothing in the cabinet? The answer is stranger and far more impressive than you'd expect. Let's start with what we know for certain. Because the first painkiller was never a plant and never a pill. It was already inside them. Your body makes its own opioids. We call them endorphins, and the word literally means the morphine within. When you're injured, when you're terrified, when you push your body past its limit, your brain floods itself with chemicals that smother pain on the spot. It's why a soldier can take a wound in the middle of a fight and not feel it until hours later. It's why a runner, miles in, stops hurting and starts floating. And ancient humans were persistence hunters. They chased prey on foot for hours under a punishing sun until the animal collapsed. The same chemistry that gives you a runner's high was, for them, survival equipment. Their bodies were built to keep moving through pain. The first pharmacy was the one they were born with. But the body's own chemistry only goes so far. So they went looking. And here's the remarkable part. They found things that actually work. Around 50,000 years ago, in a cave called El Cidrón in northern Spain, a Neanderthal was suffering. We know this because researchers recovered his teeth, and locked inside the hardened plaque was a record of everything he'd been chewing. He had a dental abscess, one of the most savage pains a human body can produce, and a gut crawling with parasites. And he had been eating poplar. Poplar carries a compound called salicin. Salicin is the molecule that, tens of thousands of years later, we would turn into aspirin. A Neanderthal, before our species had even spread across the planet, was self-medicating with the active ingredient in your medicine cabinet. That wasn't a fluke. The willow tree carries the same compound, and humans reached for it everywhere. The Sumerians pressed it into clay tablets 4,000 years ago. The Egyptians wrote it into the Ebers Papyrus, around 1500 BC, for pain and inflammation. And in Greece, Hippocrates himself told patients to chew willow bark and drink willow tea to bring down a fever and ease their aches. Different continents, different centuries, the same tree, because it worked. And they had figured that out by watching, tasting, and remembering. Then there was the poppy. Across Neolithic Europe, more than 5,000 years ago, people were already cultivating the opium poppy on purpose. The Sumerians left records of it. The Egyptians listed it in that same papyrus for its power to calm and to sedate. This is the plant that gives us morphine, still, to this day, the benchmark that every other painkiller is measured against. Ancient humans didn't understand the chemistry. They didn't need to. They knew this single flower could reach into a suffering body and quiet it, and they grew it, season after season, generation after generation. But the most haunting evidence of how seriously they took pain doesn't come from a plant. It comes from a body that melted out of a glacier. In 1991, 2 hikers in the Alps found a man emerging from the ice. He had been there for 5,300 years. We call him Ötzi. And when scientists examined his preserved skin, they found something nobody predicted: 61 tattoos. Not images, not decoration, simple lines and crosses made by rubbing charcoal into small cuts in the skin. And when researchers mapped where those tattoos sat on his body, the pattern was impossible to ignore. They clustered over his lower back, his knees, his ankles, exactly the joints his skeleton shows were ground down by arthritis. Exactly where a man in his 40s who walked those mountains for a living would have hurt. Ötzi's tattoos weren't art. They were treatment, pressed into the places that ached, by people trying to make him feel better. And tucked into his gear he carried a fungus birch polypore with antibacterial and anti-inflammatory properties. He was walking through the Copper Age carrying a first aid kit. And then there's the procedure that, the first time you hear about it, sounds like it can't possibly be true. Ancient humans drilled holes in each other's skulls. It's called trepanation, and it is the oldest surgery we have ever found. At a site called Ensisheim in France, archaeologists uncovered a skull with an opening cut into it that is 7,000 years old, and it is not rare. Across Neolithic sites, somewhere between 5 and 10% of all the skulls we recover, thousands of them have these holes. They scraped through living bone with sharpened flint. No anesthesia, no antiseptic. The patient was awake. Now, you're probably thinking the obvious thing. They must have died. Surely cutting into a skull with a rock was a death sentence, or something done to a body that was already gone. But the bone tells us otherwise. Around the edges of those openings, the skulls show new bone growth, smooth, rounded, remodeled. And bone only does that in a living body, slowly, over months and years. These people didn't just survive having their heads opened with a stone tool. Many of them lived for years afterward. Some skulls show the operation was done 2 or 3 times to the same person, and they survived every single time. Here's the detail that should stop you cold. In the 1800s, with metal instruments and real hospitals, the survival rate for this exact operation barely reached 10%. Stone Age humans were outperforming Victorian surgeons, and they were almost certainly doing some of it to relieve the pressure and the pain of head injuries. Though even now we're not always sure why, and they were good at it. So they had the body's own chemistry. They had willow and poppy, they had tattoos and surgery. But the most powerful painkiller they ever discovered wasn't any of these things. It was each other. In 2007, in northern Vietnam, archaeologists Lorna Tilley and Mark Oxenham uncovered a skeleton at a site called Man Back. They named him Burial 9. He had died around 4,000 years ago, in his mid-20s, and his bones told a brutal story. A rare condition called Klippel-Feil syndrome had fused his spine and paralyzed him from the waist down before he was even a teenager. He couldn't walk. He could barely move his arms. He couldn't feed himself, couldn't clean himself, couldn't roll over in the night. And he lived like that for about 10 years. Sit with what that means. In a small Stone Age community, where the bones of his neighbors show that famine was never far away, where nearly half the children died before the age of 5, these people kept a completely dependent young man alive for a decade. Someone fed him every day. Someone lifted him and carried him. Someone cleaned him and turned his body so the bedsores wouldn't take him. For 10 years, he could offer them nothing in return, and they did it anyway. When he finally died, while everyone else at that site was buried lying straight, they laid him down, curled gently on his side, the way he had spent his life. That is the real answer. That is how ancient humans dealt with pain. They couldn't always stop it. Often they couldn't even dull it. But they refused to let anyone carry it alone. For almost all of human history, pain was not a private problem you silenced behind a closed door. It was something the whole group absorbed together. You hurt, and the people around you sat with you in it, treated you with what little they had, and stayed. And here's the strange thing about you. You have the pill they would have wept for. You can erase, in 20 minutes, the kind of agony that could define an entire ancient life. By every measure that matters, you won. The toothache that might have ruined a month of someone's life 10,000 years ago is, for you, a quiet walk to the pharmacy. But somewhere along the way, as the pain got easier to silence, the circle around it got smaller. We treat pain alone now. We take the pill alone, lie awake alone, heal alone, behind our own walls. They had almost nothing to kill the pain, and they never once had to face it by themselves. You have everything to kill the pain, and more, you face it on your own. They didn't have painkillers. They had each other. And for 300,000 years, that was enough.